this is Dr. Govind Rai Garg. In this video, we will discuss about oral contraceptives. The first question is, what do you mean by oral contraceptives? The name says these drugs are given orally and they are used to prevent conception. Or in simple language, if we say, they are used to prevent pregnancy. Now for that, we need to understand how pregnancy occurs. So first we'll try to understand how ovum and sperm meet. So basically it is a love story of sperm and ovum, and these drugs, they will inhibit the love story of the sperm and ovum. ये जालिम दुनिया वाले हैं. So first of all we'll try to understand how this love story progresses. Now if you see, this is the ovary which contains ovum. Ovarian follicle is present in which ovum is present. So this is ovarian follicle, this is ovum. These are fallopian tubes. This is uterus. Now it is a love story between sperm and ovum. So ovum is the heroine here. So ovum is lying in its house. The home of the ovum is ovarian follicle. So for meeting with the sperm, this is the meeting place they have kept here. They will meet here. But for meeting here, the ovum has to come out of its house. So first step is this ovum, it comes out of the ovarian follicle into the fallopian tube. The process is known as ovulation. And we all know ovulation occurred due to LH surge on the mid-cycle. On the 14th day, suddenly LH increases, that lead to ovulation. So ovum has come into the fallopian tube, it has come out of its house. Then with the help of movement of fallopian tubes, these fallopian tubes move. So ovum will slowly start going toward the meeting point. So ovum comes out of its house and slowly reach the meeting point. Now the hero, which is sperm, hero comes on this side from the uterine side. So during copulation, sperm is sent into the vagina, and through the uterus, the hero is coming. So sperm is coming from here. So it also reach the meeting point. So now this sperm and ovum meet. And after meeting, they build their house at this place. The zygote is implanted here. This is known as implantation. Okay. So quickly revising, the ovum comes out of its house, ovulation. With the help of movement of fallopian tubes, reach the meeting point. Sperm come from the uterine side, reach the meeting point. Both of them meet and then they implant in the uterus. So if we stop any of these processes, we can prevent pregnancy. So the options we have are, first thing we can do is we can inhibit this. That means we can lock the ovum in its house. Just like in the old movies, we lock the ovum in this heroine in the house. Heroine cannot come out, and when she is not able to come out, she cannot meet with the hero. Okay, so that is the inhibition of ovulation. So if we inhibit the LH surge, then ovulation will not occur. So ovum cannot meet the sperm. Second, we can remove this support. The friends of ovum which were supporting the heroine and to reach the meeting point, if we remove those friends, then it will not reach the meeting point. So that means we can inhibit the fallopian tube movements. If fallopian tube motility is affected, it will not be able to reach the target point. Third thing, we can send gundas here. The hero which is coming, we will send the people to kill him. Yeah? So that is the process, making the cervical mucus thick and hostile. Sperm has to penetrate through the mucus in the cervix. If that is thick and that contains the enzymes to kill it, so then it will not be able to reach the meeting point. So pregnancy cannot occur. So third mechanism is to make cervical mucus thick and hostile. And suppose in spite of all these problems, their love story, or we can say their love is true, सच्चा प्यार था, then what we can do? They have met and they have built their house. Now what we can do? Just like we do in Haryana, honor killing कर देंगे. So we can remove this implant also. So these are the four main mechanisms of oral contraceptives. We'll write here quickly. 1. Inhibit ovulation. 2. Decrease fallopian tube motility. 3. Make cervical mucus thick and hostile. And 4. Inhibit implantation. So all the oral contraceptive will act by these four mechanisms, but the most common or most important will be different in different contraceptives. Okay, so we have three type of contraceptives. One is called combined oral contraceptives. Combined means estrogen and progesterone are combined in this. Second is called as progesterone only pills. So as the name tells, only progesterone will be there. And third are emergency contraceptives. Three type of contraceptives we will discuss. The main mechanism in case of combined oral contraceptive is number 1 mechanism, that means inhibition of ovulation. Main mechanism. Main mechanism in progesterone only pill is number 3 mechanism, that means they make the cervical mucus thick and hostile. Main mechanism in emergency contraceptive is number 4, they inhibit implantation. Remember, all 4 may be operative in all, but most important, combined oral contraceptive inhibit ovulation. Progesterone only pills, they make cervical mucus thick and hostile, and emergency contraceptives, they inhibit implantation. So these are the main mechanisms. So now we'll discuss these one by one, starting with combined oral contraceptives. So as we already discussed, we use estrogen and progesterone combination. The estrogen most commonly used is ethinyl estradiol. Progesterone commonly used is levonorgestrel. Combined oral contraceptives. Now these contraceptives, these combinations, they are given for 21 plus 7 days. Means they are given continuously for 21 days and then there is 7 days break. So we start the tablet on the first day of the menstrual cycle, give it for 21 days, then give 7 days break. After 7 days break, again we start for with the first tablet for 21 days. The first question is why we do like this? This is to mimic the endogenous cycle. Just like in the endogenous cycle, first estrogen progesterone increase and then suddenly decrease in progesterone lead to withdrawal bleeding, and that withdrawal bleeding occur for 7 days and again we start the new cycle. Okay, but the problem is when we ask the female to take the tablet for 21 days and then do not take for 7 days, so she will start on the first day, no problem, she will take for 21 days, but after that she will stop. For 7 days she will not take. But many times it happens that she forgot to take even after 7 days. So that can lead to decrease in efficacy. So that this problem do not occur, we do not ask the female to take for 21 plus 7. Instead, we make a strip of the tablet which contains 28 tablets. In these 21 tablet, they contain estrogen plus progesterone. But 7 tablets, they do not contain anything, only iron. No steroids, only iron is there. And we label them on the strip day 1, day 2, day 3, day 4, day 5. So till 21 days, the female is taking tablet according to the day. It is estrogen plus progesterone. But from 22 day, the female will take same tablet, just written day 22. But that tablet do not contain the estrogen progesterone, that contain only iron. So we will get 21 plus 7 also, and there is no problem of forgetting also. So after 28 days, female will take another strip, open it and use for 28 days. Okay. Now here comes the problem. The first problem is a female has started taking oral contraceptive. She is taking it successfully for 6 months, 7 months, 8 months. And now suddenly the call came to gynecologist that I had taken the tablet since 10 days, for first 10 days. But yesterday was 11th day and I forgot to take the tablet. What should I do? So if one tablet is forgotten, she should take whenever she remembers. Suppose she was taking in the morning daily and she forgot to take in the morning, but in the evening she remembers, take it at that time. And next tablet again next day. But suppose whole day has elapsed, she has not taken, then in the next day take 2 tablets and continue. So like 11th day has been missed, so on the 12th day take tablet of 11th day also, 12th day also, and continue. But if tablet is missed for more than one day, then very high chances that the therapy may fail. So we will not rely on contraception here. So what we advise is, whichever tablets you have not taken, throw them in the dustbin. Now take one tablet as the day it is. Suppose she has forgotten to take 10, 11, 12 days. So throw those 3 tablets. Today is day 13. Take the tablet of day 13, day 14, day 15 as usual. But during this period, use some other method of contraception, because it will not be able to prevent pregnancy. So what should be done? Tablet should be removed, whichever is not used, and continue from now. The question is, when it is not protecting, then why to take? Because we do not want to disturb the menstrual cycle. We want that cycle should remain same. Okay. So important thing, if one tablet is missed, we can continue same, take on the next day and continue. But if more than one is missed, then we should not rely on this method of contraception. Okay. Now there is 2 types of bleeding. One is called as withdrawal bleeding. Second is called as breakthrough bleeding. First of all, what are these? We'll try to understand. Withdrawal bleeding, as the name tells, this is the vaginal bleeding which occurs when we withdraw the steroids. This is a normal physiological thing. We know every menstrual cycle, the female develops vaginal bleeding for few days. The reason is, in the body, in the uterus, estrogen is increasing, progesterone is increasing, and when the uterus has grown to a sufficient level, now it requires progesterone support, and suddenly progesterone stop coming. When progesterone do not come, the bleeding occurs. Uterus breaks down, endometrium breaks down, bleeding occurs. So that bleeding is called as withdrawal bleeding. So when we give it for 21 days, we have gradually increased the progesterone level. And now when we suddenly stop, the bleeding will occur. That is called withdrawal bleeding. So this is normal, physiological. But if the bleeding occurred during first 21 days, that is called breakthrough. That is not a normal bleeding. Breakthrough bleeding is not normal bleeding. So this bleeding has occurred because of sudden increase in progesterone. We are not able to mimic the endogenous cycle. So sudden progesterone can lead to breakthrough bleeding. So if a female develops bleeding during first 21 days, that means breakthrough bleeding. How to stop that? So for that we have made special pill called as phasic pills. In normal combined oral contraceptive pill, which is non-phasic, from day 1 to day 21, all pills contain same amount of estrogen and progesterone. But in phasic pills, we have 2 types of phasic pills, biphasic and triphasic pills. In biphasic pills, we have 1 to 10 day less amount of progesterone, 11 to 21 days slightly more amount of progesterone. So less progesterone, more progesterone. In case of triphasic pill, for 1 to 5 days, we have less progesterone. 6 to 10 days, we have slightly more progesterone. And then 11 to 21 days, we have full progesterone. So what we want to tell is, here we are increasing the progesterone gradually in phasic pills, okay? So that breakthrough bleeding do not occur. Okay. Now coming to adverse effects of oral contraceptives. Adverse effects, we can divide them into mild, moderate and severe. The basic thing is, mild side effects, they normally occur. No need of stopping the OCP. We can continue OCP. Moderate means, here we can think of stopping, but it is not necessary. But in severe, we have to stop. OCP, whenever these side effects occur, OCP has to be stopped. Okay? Now starting with the mild adverse effects, so you can remember them as normal. We discussed they normally present. So you can remember them as normal. N for nausea. O is edema. R is recurrent headache. M is mastalgia. A is abnormal bleeding. And L is loss of withdrawal bleeding. Nausea, edema, headaches. Recurrent headaches can occur. So OCPs should be avoided in a female with history of migraine. Recurrent headaches can occur. Mastalgia means breast tenderness. This can occur. Abnormal bleeding. Which bleeding was abnormal? Yes, that is breakthrough bleeding. Breakthrough bleeding. Now breakthrough bleeding initially can occur in first 1, 2 or 3 cycles, and normally it automatically normalizes. So we need not stop. But if it continues, then we can use phasic pills. Okay. Then loss of withdrawal bleeding means even after 21 days bleeding do not occur. So this can occur initially in the few cycles, but it will also normalize with the time. Okay? So these adverse effects we should not stop. We can continue. Okay? Then coming to moderate adverse effects, they are mostly cosmetic adverse effects. So you can remember them as A, B, C. A means acne. B means bulky female. Bulky means weight gain. And C means cloasma. Cloasma means pigmentation of face. So these are cosmetic side effects. So will the female die if we do not stop OCP? Obviously not. But the doctor who is treating will die if we do not stop. Yeah? So in consultation with the female, if she is worried about these cosmetic problems, then we can stop. Otherwise we can continue. Okay? Then coming to severe, which are the most important, these are 4 C's. First C is cardiovascular. We know estrogen increases the risk of thromboembolism. So thromboembolism, these are the important adverse effects. So any hint of thromboembolic episode, maybe deep vein thrombosis, MI, stroke, we should immediately stop OCPs. Second C is CNS. OCPs, they can unmask these depression. They themselves do not cause depression, but it has been found to unmasking the subclinical depression. So OCP should be stopped at first hint of depression. Third C is cholestatic jaundice. Estrogens, they increase the lithogenicity of bile. So if there is any hint of cholestatic jaundice, OCP should be stopped. And last C is cancers. OCPs increase the risk of cervical cancer, and high dose estrogen pills, they increase the risk of breast cancer also. So nowadays there are low dose estrogen pills also, they do not increase, but high dose estrogen OCPs, they can increase the risk of breast cancer also. But regarding cancers, OCPs are also protective to some cancers. So basically we discussed they increase the risk of cervical cancer and breast cancer, but they decrease the risk of endometrial cancer and ovarian cancer. So how to remember which cancer risk is increased, which is decreased? It is very easy to remember. Just divide the body into 2 parts from the diaphragm. Make it 2 parts. Upper cancers go up, lower part cancers go down. Upper, above the diaphragm we have breast. So breast cancer risk high, up. If we see above cervical, obviously we are not talking about this cervix. It is talking about cervix, just to remember. So cervical cancer risk is increased. But below the diaphragm, that means ovary and endometrium, cancer goes down. Okay? So increase the risk of breast and cervical, but decrease the risk of endometrial and ovarian cancer. Okay. So these are the important adverse effects of OCPs. So we have completed the combined oral contraceptives. Now coming to progesterone only pills. So progesterone only pills, where we will like to use? Where we cannot use estrogen. Obviously they will be less effective than combined. Had they been more effective, obviously we should not have combined estrogen. Okay? So progesterone only pills, we commonly use levonorgestrel pills. So they are used when we cannot use estrogen, and estrogen cannot be used in 2 particular circumstances. One, when there is high risk of thromboembolism, we should not use estrogen, so we can use these drugs. And second, very important, they are used during lactation. Contraceptive, oral contraceptive of choice during lactation are progesterone only pills like levonorgestrel. They are given continuously. There is no 21+7 day break, 1 tablet daily. Okay. Major mechanism is they make cervical mucus thick and hostile. Clear? Then we have emergency contraceptives. Emergency contraceptives. Remember, progesterone only pills are also called as mini pills. emergency contraceptives, they are also known as post-coital contraceptives. Post-coital contraceptives, coitus means intercourse, sexual intercourse, after the sexual intercourse, and they are also known as morning after pills. Morning after pills. So from the name you can understand morning after pills. You are sensible enough to know after what. Okay? So after the unprotected sexual intercourse. So what they do in emergency contraceptive, first of all, emergency contraceptives are normal contraceptive. That means we can use either combined oral contraceptives or we can use mini pills. That means progesterone only pills. Combined oral contraceptives, 2 tablets can be given immediately followed by 2 tablets after 12 hours. Progesterone only pills, we can do same thing, 1 tablet immediately plus 1 tablet after 12 hours or 2 tablets stat. Then third type of emergency contraceptive we can use is selective progesterone receptor modulator, which is called as mifepristone. Mifepristone. Now all these emergency contraceptives, they should be used within 72 hours of unprotected intercourse. So within 3 days of unprotected intercourse they should be used. After that they are less likely to prevent pregnancy. They should be used as early as possible, but maximum within 72 hours of unprotected intercourse. Okay? Now recently we had developed one more emergency contraceptive, that is also SPRM, selective progesterone receptor modulator. The name is Ulipristal. Ulipristal. The dose of this is 30 milligram, but special thing to remember, it can be used up to 120 hours of unprotected intercourse. That means up to 5 days. All other can protect up to 3 days. This can protect up to 5 days. Clear? So these are emergency contraceptives. Now these contraceptives, combined oral contraceptives, emergency pills, etc. These contraceptives, they have some other advantages also apart from protecting the pregnancy. And what are the other benefits? So you can remember them from the mnemonic other benefits. Other benefits of oral contraceptives. So one by one we will discuss. Other benefits. O means ovarian cyst. They decrease the risk of ovarian cysts. In fact, oral contraceptives are very commonly used drugs in polycystic ovarian disease. In fact, they are drug of choice for polycystic ovarian disease. Then B for benign breast disease. OCPs decrease the risk of benign breast disease. Fibrocystic disease of breast, the risk is reduced. Then E means endometriosis. OCPs decrease the risk of endometriosis. N is neoplasia. OCP decrease the risk of certain neoplasms we just discussed. They decrease the risk of endometrial and ovarian cancers. Then E for ectopic pregnancy. OCPs decrease the risk of ectopic pregnancy. F is fibroid. OCPs decrease the risk of fibroid, leiomyoma. They decrease the risk of iron deficiency anemia. There are 2 reasons to this. Number 1, we are giving iron for 7 days. And number 2, when the cycle is regulated, there will not be excessive bleeding. So iron deficiency anemia chances are less. Then T means tension syndrome. OCPs decrease the risk of premenstrual tension syndrome. And S means skeletal problem. They decrease the risk of skeletal problem. Which problem can you guess? Estrogen. Yes, they decrease the risk of osteoporosis. Osteoporosis. So these are the other benefits of OCPs apart from providing the protection against pregnancy. Okay? So these are the important points regarding the oral contraceptives. Thank you.